Hello! Uh, Today I'm going to show you um, how I'm using the FFP3 masks in work. But first, what is FFP mask and what is the difference between different masks? So FFP stands for filtering face piece, and by the different levels of filtering of airborne particles, there are 1, 2 and 3, FFP 1, 2 and 3 accordingly. So FFP1 is the least filtering. It filters approximately 80% of airborne particles. FFP2 filters approximately 95%, and FFP3 are the best ones, and they're supposed to filter 99% of particles and virus particles accordingly. They differ by the color of the straps. For example, this mask here has got red straps, and this is FFP3, the best one. The masks with white or blue straps, so you see these are white straps, this is FFP2, and the one they have got yellow straps. So these masks, they are very important to cover very well around the nose, mouth and chin to protect all this area, and therefore just buying, for example, FFP3 and put it on doesn't mean it will provide you the protection required, because it may not cover well on your face and not providing you with the desirable protection. And therefore in the hospital, every single clinician needs to go to face fitting, mask fitting, whereby they measure with a special device the actual amount of particles entering through the mask and the particles you actually breathe. So the standard of our machine for the masks is less than 100 particles, but still for COVID, for example, you need 20 particles to get infected. So it's still not 100% protection, but it's still some sort of protection. So because these masks, they have very thick layer in front, and sometimes the breathing may become very difficult, especially if you need to wear them long hours, and therefore some of the masks, they have exhalation valves in the middle, whereby they permit the exhaled air, they let the exhaled air go out of the masks, which makes it easier to breathe. But this type of mask with an exhalation valve is not protecting the others, which means if the person who is wearing this type of mask has got the virus, they will still exhale the virus and may infect environment and the other people. Okay, back to the masks I'm using in the hospital. So because they are expensive pieces, we use them only when performing high-risk procedures such as aerosol producing surgery, and one mask is for one person only. And these two pieces, they are made in UK. I've got the FFP3 with red straps by Aura, and also FFP2, which I've been fitted to this one as being FFP3. It's also UK one by GVS. These masks, they differ a lot. I'll start with this one, which is very uncomfortable. So here at the nose, because it must fit very well around the nose and it must be tight, they have got soft padding around the nose. If you wear glasses, you need to take your glasses off first. Now, for women with long hair, it's a must to have your hair tied in ponytail. For males, all the facial hairs must be removed, because any beard will also compromise the fitting. So you need to open. To make it tight, you can tighten the straps, but I'm not going to do it now. So put it on your face first, and then the top one goes on the top, and the lower one must go below your ears and below your hairline. So make sure the bottom one, the bottom edge of the mask goes under the chin, and then it works much better if you put the nose edge as high as you can. So yes, it could be very challenging, so it must be high enough, and with both hands, not one hand and pinch. This is incorrect. With both hands, you need to press it so that it goes very well on the top of the mask. And then you put your glasses on. So if you start breathing and you see mist on your glasses, this means the mask is definitely not filtering well. So you shouldn't have your glasses misted during the procedure, because this means it's allowing the air coming in and out through the space between the nose and mask. Okay, and therefore, actually, to make it more protective, we also wear visors, not just the mask, but a visor on. Okay, so this one is extremely uncomfortable. This is metal here, which makes it very tight. Breathing is definitely difficult. There are problems in conversations with the staff and patients. So it's really challenging working with this mask on. And when you take it off, yes, I always take my glasses off before, you see the actual traces from the mask on your face, and these traces may remain for several hours afterwards, especially if you've worked all day with the mask. So now I like Aura ones. They are much softer and feel nicer. And they are red strapped, which is FFP3, and it's pretty much the same basically. So unfold it, put the chin piece first, and then the straps go the similar way, the one on the top, the second one behind, and then put this on the top of your nose. If it goes lower and then you tight it, this hard edge will pinch your nose and you will start talking like this. So make sure, this is really the most important tip, is to put the top one as high as you can to make it easier for you to talk and to make it more protective. And when it's higher at the top, then press it. Okay, so now I've got very good lining here, and I'm confident that this is protected and it feels much better. And then I put my glasses on. I'm breathing, and yes, I can see there is a bit of misting from time to time, but I think because this is already used, what I've noticed after one use, the straps become looser, and therefore they don't recommend using one mask for several patients in a row, because the quality of protection actually wears off if you use it frequently and more than once. So this is also very important if you want to have a good protection. You need to bear in mind all these little tricks. Okay, so I think this is it really, but of course just a mask is not protecting. You need to combine it with frequent hand washing and all the other measures. Yes, the visors and wearing gloves for the medical staff, but I'm sure you've had the training in your own hospital, so this video is more for the people in public, because I've seen actually in shops and on the street people wearing this type of expensive filtering face pieces, but actually I see people are not wearing it correctly, especially a lot of men with long beards. They are definitely not getting the protection, so it will be much cheaper to just wear the normal mask, which is just a piece of tissue, really, or a cloth. Not wasting your money, because if you buy something like this, you need to know how to wear it and to get the most of it, really, and to know that the more you use it, the less effective it becomes with time. And yeah, most importantly, it must fit very well around your face. Okay, so Angel is
a member of the public. After watching the video, I felt an instant desire and need to try these special masks on me. Thank you very much for bringing them. They were used though, we didn't waste any masks.
No,
the hospital.
he is using my mask.
Yeah.
So how do you feel with the mask on?
I feel, I also saw myself in the mirror. This beak, this extension of mine, it's pretty uncomfortable, and I hate the normal masks. This one, it's basically very much on me, and when I breathe, it gets like this. You can feel it sticking on your face. It's really
and definitely makes your breathing very difficult. Not just breathing, but talking, and you need to put extra effort to talk loudly so that patients can hear you, especially elderly patients with hard hearing.
Yeah.
It may become really a burden during your normal day-to-day work.
And the only thing that saves me, it feels really like we had the gas masks in the army, where you basically, in order to be able to breathe and survive, you needed to loosen them and get some air out of it. It's the same, because it doesn't fit me completely. There are some holes and where the
exhalation, to make artificial exhalation valve. Yeah, which reminds me, I also see people in public with the masks with exhalation valves, which means if these people carry carriers of the virus, they are actually not doing anything with this mask, because they are still exhaling particles. Yes, you've got very nice marks, traces.
Yeah, well, let's try the most expensive one, the red one.
The red stripes. FFP3. I forgot to mention here, this part is much softer and a bit thicker comparing to this one, and at the front this one has got the metal line, whereas this one is a bit, it's also a bit kind of metal, but it's softer, more pliable.
Yeah, there is some metal lining here.
So yeah, put it on. Did you?
Yeah, I now remember how.
You remember? You need to. No, you still don't remember. Okay. You need to unfold.
Yeah, I thought it was unfolded. Yeah, excellent. Yes. So I'm unfolding it.
Yes.
Like this. Then the second one should go under my.
Yeah, this is the top. The top one is.
Oh, thank you very much.
On the across the vertex is the anatomical place of the scalp.
So I go to the top.
And then mold it.
Press here.
Okay.
So yeah, it's certainly more comfortable than the other one, but let's see. But the breathing, probably because it's more on me, it just feels very hot when I exhale, and it's not nice. I don't know how you basically do long hours with this at the hospital. It's really
It's
not
good.
nice.
It's good because we've got breaks and some turnaround time between patients. So, in essence, overall, the time you wear the mask is up to 45 or 50 minutes is the maximum time you wear one mask on, and then you've got 5 to 10 minutes break in between patients until you do your paperwork and so on. So it's not, it's bad, but not too bad.
I think all the people in the NHS who do this every day, that's a lot of sacrifice, and because
It is, yeah.
I can barely survive 30 minutes in the supermarket with this thing, and you guys spend the whole day with these really nasty
Yes.
masks. It's really, yeah, well, thank you for doing that. And just finishing, let me give you one advice for as a member of the public, how to wear these masks.
Okay.
The mostly, because, and I didn't know, but I thought the blue bit needs to go from the inside, but it's actually the other way
Yeah.
around. So the blue one should be like this, and also on the mask on one side there is a metal, some
It's a plastic. I don't think it's a.
yeah, it could be plastic. There is something like harder. So this one should go to on the top,
Of the nose, yeah.
and then you do like this.
And again under the chin.
Is it a problem to have beard with this mask?
Yeah, of course. Any facial hairs will prevent from good aligning of the mask on the face, and will create a gap basically. The facial hair, the beard will create a gap where the air from outside will go inside.
But
And the other way around.
this one feels better than the more professional mask.
Yes, because there is plenty of
Yeah,
space,
I like
gaps,
I like it.
gaps where the outside air is coming through, and therefore it's probably 60% filtration rate.
Yeah, and you can, right.
Yeah, just for example, the red stripes is 99% filtration, white ones are 94%.
This one how much?
I don't know, but I'm guessing it's just guesswork, yeah? Probably 50 or 60%.
There is one panel with information.
And if you wear it like this under your nose, it's 0%.
I think there was one panel with some pictures. I think it was if you are infected and the other person isn't. If you have this, it's a 30% chance for the other person to get infected. So probably this one, I mean, from that picture, my most of my knowledge comes from such sources.
Okay.
It's
From papers and journals.
yeah, 70%. My guess is 70%
70.
protection. Well, 70 sounds
Yes.
okay. Yeah, cool. Very good. Well, thank you, Svetlana, for this very informative lecture.
You are most welcome, my dear.
Well, guys, I hope this was also helpful, interesting to you. See you next time. Bye.
Bye.